The Black Death, a devastating pandemic that swept across Europe, Asia, and Africa in the mid-14th century, remains one of the most terrifying events in human history. This catastrophic plague, now known to have been caused by the bacterium Yersinia pestis, wiped out an estimated 75 to 200 million people, leaving an indelible scar on the world. Its rapid and relentless spread, facilitated by a complex interplay of factors, serves as a chilling reminder of the vulnerability of human societies to infectious diseases. The Black Death's impact extended far beyond its staggering death toll. It reshaped societies, decimated economies, and left an enduring legacy of fear and uncertainty. Understanding how this devastating plague spread so rapidly is crucial not only for historical understanding, but also for informing our approach to present and future pandemics. The Black Death's journey across continents was a complex and multifaceted process. While the plague likely originated in Central Asia, its transmission was facilitated by a network of interconnected factors, including trade routes, urbanization, and environmental conditions. By examining these factors in detail, we can gain a deeper understanding of how this devastating pandemic took hold of the medieval world. The rapid growth of cities in the 14th century, while a testament to economic and social progress, inadvertently created ideal conditions for the Black Death to thrive. Overcrowded urban centers, often lacking proper sanitation and hygiene, became fertile breeding grounds for disease. Medieval cities were densely packed, with narrow streets and houses huddled closely together. This close proximity made it easy for the plague, which spread through respiratory droplets and the bites of infected fleas, to pass quickly from person to person. Sanitation was rudimentary at best in medieval cities. Waste disposal systems were inadequate, and open sewers often ran along the streets, providing ideal breeding grounds for rats, the primary carriers of the plague-carrying fleas. The lack of proper sanitation contributed to the rapid spread of the disease, as contaminated water sources and unsanitary living conditions facilitated the transmission of the bacterium. Overcrowding also placed a significant strain on the limited resources available in medieval cities. Food and water were often scarce, and housing was inadequate to accommodate the burgeoning urban populations. These factors, combined with the constant influx of people from surrounding areas, created an environment where disease could easily take hold and spread rapidly. Trade routes, while vital for economic and cultural exchange, also served as unwitting conduits for the Black Death's deadly journey across continents. The Silk Road, a vast network of trade routes connecting east and west, played a particularly significant role in the plague's spread. As merchants and travelers traversed these routes, they unknowingly carried infected fleas and rats, along with the deadly bacterium, to new territories. Ships arriving in bustling ports, laden with goods from distant lands, also brought with them the unseen threat of the plague. Rats, infesting ships' holds and seeking food and shelter, carried infected fleas to new populations, spreading the disease from port cities to inland areas. The interconnectedness of the medieval world through trade routes facilitated the rapid and widespread dissemination of the Black Death, making it virtually impossible to contain. The movement of goods along trade routes also contributed to the spread of the plague. Infected fleas could hitch rides on fabrics, grain, and other traded items, unknowingly transported by merchants and travelers. These goods, once they reached their destinations, could then introduce the plague to new communities, further fueling its relentless advance. The state of public health in 14th century Europe was woefully inadequate to cope with a pandemic of the Black Death's magnitude. Medieval medical knowledge was limited, and treatments for the plague were often ineffective and sometimes even harmful. The miasma theory, which held that diseases were caused by bad air, was prevalent, leading to misguided attempts to purify the air by burning incense or wearing fragrant herbs. Hospitals, often run by religious orders, were ill-equipped to handle the overwhelming number of plague victims. Overcrowding in hospitals, coupled with a lack of understanding of how the disease spread, likely contributed to the high mortality rates within these institutions. Medical practitioners, often lacking formal training, struggled to cope with the sheer scale of the outbreak. The Black Death exposed the fragility of medieval healthcare systems and highlighted the urgent need for improved sanitation, hygiene, and medical knowledge. The pandemic served as a brutal catalyst for change, prompting a gradual shift towards more scientific approaches to medicine and public health.